The other type of replacement is a standard, what we call anatomic replacement. So in that situation where the ball and socket are in a normal anatomy, is exactly what we do is we remove the arthritic surfaces of the ball and place a metal ball there, and we resurface the socket because your rotator cuff is working appropriately. Now, I may add, Michael, if it's okay, just a little bit about some of the advances in that procedure.
Absolutely. That was my mind went right there as well. So
okay.
Please.
So the implants in the standard anatomic replacement, we used to have these stems that we'd put into the humerus that were roughly 4 inches long. Over the last 5 years, we've been able to narrow them to about 2 inches long. And then in their most recent advance, we now call these implants stemless because they're so short that they don't even go down into the canal of the bone. And that has led to the ability to then think about the approach or limiting another complication of an anatomic replacement. When we go into the shoulder through the front, we have to remove one of those healthy rotator cuff muscles to access the joint, do our work, and then at the end of the surgery, we have to repair that. That's called the subscapularis. And every conference I've been to in my training, there's always a discussion about how do you handle the subscapularis, because if it doesn't heal back, the shoulder replacement is pretty much useless. It dislocates and it causes a lot of pain. People can't really get much relief from that. So if there's a way to perform that surgery without removing the subscapularis, that would be a huge advancement. The reason people stay in their slings for so long after an anatomic replacement is 6 weeks is because you're waiting for that to heal back. Now, a reverse replacement, the way that I perform it, we don't have to repair the subscapularis, and so people are in their slings for only 2 weeks. Wouldn't it be nice to move those shoulder replacements anatomically to that same sort of limited sling wear, and they could get back to their life a lot faster? So there's been some recent advancements, and they're still working on that. Some of it has to do with robotics, but some of it also has to do with the approach. So I went most recently, it was like 3 weeks ago, down to meet with a gentleman, another surgeon down in Cincinnati, who has developed an approach that he's doing really well with. And so he trained me on how to do that. And currently I'm the only one between here and LA, Los Angeles, between Cincinnati and Los Angeles, who's performing those procedures. So we take somebody from a shoulder replacement immobilizing for 6 weeks down to 6 days, and they're out and moving their shoulder within that time frame. So that, I think, is one of the most intriguing advancements in shoulder replacement as of this year. And I'm super excited to be able to provide that to anyone in our region, including those, in other parts of Idaho and Boise or, Twin Falls, Burley, Jerome, those areas. We've already had some interest in that procedure, just in letting people know that we're performing it.